Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is preparing to initiate manual lymphatic drainage on a patient with left upper extremity lymphedema secondary to breast cancer. Which finding from the chart review is a contraindication to this treatment? Option 1. The patient has hypertension with a resting blood pressure of 158 over 96 millimeters of mercury. Option 2. The patient has an active cellulitis infection with visible erythema. Option 3, the patient had a deep vein thrombosis in the right leg 6 months ago. Option 4, the patient has peripheral arterial disease affecting the left upper extremity. Before initiating manual lymphatic drainage, therapists must screen for conditions that could make treatment unsafe. Some findings are absolute contraindications requiring immediate deferral and physician consultation, while others are manageable comorbidities or precautions that do not prevent MLD from proceeding. A precaution means the therapist should be aware of the finding, exercise clinical judgment, potentially modify the approach, and monitor closely, but treatment can still proceed. It is worth noting the structure of this question. 3 of the 4 options describe findings that might raise concern but do not require deferring treatment. Only one is a true contraindication. This question is asking you to identify which of the 4 findings crosses the line from precaution into absolute contraindication. Keep that distinction in mind as we evaluate each option. Let's explore each of the options. Option 1. The patient has hypertension with a resting blood pressure of 158 over 96 millimeters of mercury. Elevated blood pressure is a relative precaution, not an absolute contraindication to MLD. While the therapist should note this and potentially consult with the physician, a blood pressure in this range does not require deferring treatment on its own. MLD is a gentle, low-intensity technique that doesn't significantly stress the cardiovascular system. It is one of the gentlest manual techniques in physical therapy, involving light, slow, rhythmic strokes that place minimal cardiovascular demand on the patient. The therapist should document the finding, monitor blood pressure throughout the session, and consider physician communication. Option 2. The patient has an active cellulitis infection with visible erythema. Cellulitis is a bacterial skin infection, and the lymphatic system is one of the primary pathways through which bacteria spread throughout the body. MLD works by stimulating lymphatic flow and moving fluid through the lymphatic channels. If active infection is present, performing MLD does not just move fluid, it mobilizes bacteria along those same channels. Active cellulitis is an absolute contraindication to MLD. Performing lymphatic drainage over infected tissue can mobilize bacteria, spreading the infection systemically and potentially causing sepsis. Treatment must be deferred until the infection is fully resolved. Option 3. The patient had a deep vein thrombosis in the right leg 6 months ago. An acute deep vein thrombosis is an absolute contraindication for MLD. However, this DVT occurred 6 months ago in a different extremity, the right leg, and the treatment is targeting the left upper extremity. A resolved DVT in a remote, unaffected limb is not a reason to defer treatment. This option is carefully constructed to test your precision. DVT is indeed an absolute contraindication to MLD only when it is acute and in the treatment area. A resolved DVT in the right leg has no bearing on the safety of performing MLD on the left upper extremity. Option 4. The patient has peripheral arterial disease affecting the left upper extremity. Peripheral arterial disease in the affected extremity is a precaution, not an absolute contraindication. The therapist should be aware that tissue perfusion may be compromised and proceed with caution and appropriate monitoring, but it does not require deferring MLD entirely. Peripheral arterial disease in the treatment extremity is a legitimate clinical concern. Reduced arterial perfusion means the tissue is already under stress, and the therapist should monitor carefully for any signs of vascular compromise during treatment. However, it does not create the same immediate systemic risk that active infection does. The therapist can proceed while exercising appropriate caution, monitoring skin color, temperature, and patient symptoms throughout the session. When we apply the absolute contraindication versus precaution framework across all 4 options, 3 of them describe findings that require clinical awareness and monitoring but do not prevent MLD from proceeding. Only option 2, active cellulitis, represents a true absolute contraindication that requires immediate deferral of treatment. The correct answer is option 2. Let's explore the all-student data. 76% of students selected option 2. The patient has an active cellulitis infection with visible erythema, the correct response. 17% of students selected option 4. The patient has peripheral arterial disease affecting the left upper extremity. 4% of students selected option 1. The patient has hypertension with a resting blood pressure of 158 over 96 millimeters of mercury. 3% of students selected option 3. The patient had a deep vein thrombosis in the right leg 6 months ago. This question is an other systems question which represents approximately 18% of all exam items. This question is an interventions question which represents approximately 26% of all exam items. This question is a level 1 question since the question requires students to possess basic, foundational, academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content? Check out page 567 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.